Many people come see us for nasal obstruction issues, recurrent sinus problems, sinus infections, allergy, and then pediatric patients would come see us for recurrent tonsillitis, recurrent ear infections. We see everyone from just after birth until we have a geriatric practice as well.
I'll see a lot of children, and then I'll have a parent say, I didn't know you see adults.
Mm-hmm.
Yeah, or this vice versa. We'll see a bunch of adults and they'll say, I didn't know you see children. Well, of course we see children. We see adults and children and throughout the age ranges.
Ear, nose, and throat, like a lot of specialties, there's a lot of room for misdiagnosis. So for the systems and the patient's benefit, it would be best if we saw them earlier on.
They are apprehensive about having the procedure, especially sinus surgery, nasal surgery. We hear a lot of anxiety related to these. We have procedures such as balloons for sinuses that are less invasive. People have horror stories in the past of 7 feet of packing in the nose. None of us do that anymore. It's all dissolvable.
Sinus surgery is not like it used to be. These patients, it's a day surgery. It takes 30 minutes, maybe an hour at most. There's no black eyes, there's no change in appearance, there's no packing. With the advances in technology and treatment and the skills and experience that we all have, that in general the juice is worth the squeeze. I mean, you may have to put a little investment in, a little time, a little energy, but it's going to be well worth it. And none of us are going to recommend surgery that isn't going to be worth it.
There's these processes that are well known in children, and we know it's certain, for example, ear infections, they're going to occur when a child is between 6 and 36 months. That's the normal range, and this has to do with more anatomic development, and so these are things that all kids are going to experience. The
other thing we're seeing a lot of is tonsillectomies that we're doing in adults, because when those adults were children, the pendulum had swung away from doing tonsillectomies. So one of the messages I'd like to get out to the community is don't be afraid to have your child taken care of early.
One thing I always talk to parents about, we see children for obstructive sleep apnea.
Yep. Good one.
With big giant tonsils, they're snoring, they have poor school performance, they have difficulty concentrating in school, different things that people don't think about, like bedwetting. A lot of these things can be attributed directly to obstructive sleep apnea, and a simple tonsillectomy can take care of that a lot of times.
The most one that I see that goes unchecked for too long is the hoarseness. What I'd like to see, I think we'd all like to see, is people in the office earlier. If you are a smoker and you've had a month to 6 weeks of ongoing hoarseness, you should be in our office.
As a general rule for referring doctors and just the general public, if a patient has a hoarse voice that's persistent for 4 weeks, they need to be in our office getting checked out.
If you have 6 or more throat infections in a year, you need to see us, or 5 per year for 2 or more years.
Mm-hmm.
If you have 4 ear infections, you need to see us. If you have 1 ear infection associated with a febrile convulsion, you need to see us.